So remember that everything that we ingest, inhale, and touch, that is going to pass through your liver. So everything that goes into your body is going to pass through your liver. So you have to be very careful about what you ingest, inhale, or even touch. So the symptoms of liver disease are very rare and they occur very late once patient has developed advanced cirrhosis. And therefore, early diagnosis can happen only through health checkups. For example, a fatty liver on ultrasound, a high SGOT, SGPT, a high bilirubin, elevated gamma GT, or platelets less than 2 lakhs. These are some of the early ways of picking up liver disease early. Now, what causes liver disease? And we know since time immemorial that alcohol is one of the commonest causes of liver diseases. And even today, that's almost 40% of the patients that we see. But remember, which also means that 60% of the patients have other causes for their liver disease. This could be viral hepatitis A, B, C, D, E, and now recently described hepatitis F is going to become a problem in the near future. Then we have what is called as the non-alcoholic fatty liver disease, which is the run-of-the-mill fatty liver in people who don't consume alcohol because of the lifestyle. A lot of medications can cause liver diseases. And in addition, there are some rare diseases like autoimmune hepatitis, Wilson's disease, Budd-Chiari syndrome, and more than 100 other causes of liver diseases. Let's see how we can prevent 95% of these problems. We'll start with something which is extremely common and present in around 2% of the population of the country, and that is hepatitis B virus. Hepatitis B virus is mainly transmitted from mother to child, either during the pregnancy or perinatally. The horizontal transmission in young children happens through close contacts and rarely happens in adulthood. Because of the immunity, even if an adult gets exposure, 95% chance that he'll clear the virus. So it's the children who are going to be at risk, and therefore the emphasis is to prevent transmission in children. And for that, we have a very effective vaccine called as the hepatitis B vaccine, which is containing a viral protein, the surface antigen. Now we also have a recombinant vaccine, which is extremely safe and effective. It is made up from a gene for the HBsAg, which is inserted into yeast or mammalian cells. What we need to really know is the dosage. So for newborns, infant, and children, adolescents less than 18 years, it's 0.5 ml, which should contain 20 micrograms, and adults is 1 ml, which should be 40 micrograms. For those who are on hemodialysis or immunocompromised, the dose is double, 40 micrograms, which is 2 ml. There are several regimens which are followed for different age groups, but the most commonly followed regimen is a 3-dose regimen at day 0, 1 month, and 6 months. Remember, if you forget to take a third dose at 6 months, you can take it anytime within the first 2 years of the first dose. If it is beyond 2 years, then you have to restart and retake the whole schedule. In children, we give it on the thigh, but in adults, we give it on deltoid. The efficacy is much better if you give it on the deltoid rather than giving it on the other sides. What are the response rates? If you complete 3 doses, it is more than 95%. But later the age of vaccination, lower is the efficacy. So if you cross 40 years, the efficacy comes down to around 90%. Between 50 to 60, it is down to 80%. And therefore, it is very important that we give the first dose as part of the National Viral Hepatitis Control Program on the first day of birth, what is called as the birth dose, and that itself is more than 90% efficacious in preventing mother-to-child transmission. In addition, now immunoglobulins are provided free of cost by the government to prevent this mother-to-child transmission to all mothers who are having hepatitis B. So antenatal testing for hepatitis B, vaccination of the newborn, and giving HBIG to the newborn on the day zero of life is what prevents more than 99% transmission of hepatitis B in the community. And the common risk factors like prematurity, low birth weight, small for gestational age, mother being immunocompromised, or presence of jaundice is not a contraindication for the birth dose. So we can give it to practically every single child. For those who already have the virus, under the National Viral Hepatitis Control Program, now the diagnostics and therapeutics are provided completely free of cost across the country. And we follow a very simple algorithm of just HbSAg, APRI, which only requires SGOT and platelet count, SGPT, viral load, and nothing else. So based on these parameters alone, we decide which patients to be treated, which patients doesn't need treatment, and the treatment is provided completely free of cost, along with all the follow-up investigations for the whole life under the National Viral Hepatitis Control Program. Coming to hepatitis C, which is transmitted through either direct blood or fluid exposure, sexual activity, or IV drug use. So these are the three commonest modalities. And this can be prevented by safe blood practices, by safe sex practices, and by harm reduction measures, and ensuring that only sterile needles are used. In addition, we screen the high-risk groups, people who have history of blood transfusion or blood products, IV drug users, antenatal mothers, people living with hemophilia or HIV, blood bank donors on hemodialysis, and we screen all these for hepatitis B and C, and wherever possible, we treat them effectively. For Hep C, again, under the NVHCP, we have a very simple regimen. We just do basic tests, CBC, LFT, RFT, and HCV RNA. We don't need to do genotype. And based upon this, we give pan-genotypic regimens, either soft-Velpa or soft-Decla or soft-Velpa-Riva. And this is effective, again, for more than 95% of patients in getting a complete cure from the hepatitis C virus. Remember, hepatitis C is completely curable. In hepatitis B, only 1% get a cure, 99% get very good long-term viral suppression. Now, coming to the major group of liver disease, which is the steatotic liver disease, both non-alcoholic and alcoholic. And this is where I think 1/3 of the population in the urban areas of the country are affected, and almost 20 to 25% of the rural areas are affected. Of those who have a fatty liver, around 30% will develop inflammation, and almost 10% are going to develop cirrhosis of liver, and 2 to 3% will develop HCC. This is how we now call NAFLD. And alcoholic liver diseases are renamed as MASLD, which is metabolic dysfunction associated steatotic liver disease. We have alcohol associated steatotic liver disease. We also have genetic and drug induced fatty livers. And finally, we also have a group of cryptogenic. Those who have both metabolic risk factors like obesity, diabetes, hypertension, and are also consuming alcohol, for them now we use a new term called as MET-ALD. And of course, the diagnostic criteria for MSLD are now based on BMI, sugars, blood pressure, triglycerides, and cholesterol, because these are the risk factors. And if you want to prevent this disease, this is what you need to really prevent. So if you see at every stage, even before any damage has happened in stage 0, what we need is lifestyle intervention, diet and exercise. We need to, if required, if there's severe obesity, bariatric surgery. But once damage sets in, once the patient starts getting fibrosis, that is when pharmacotherapy starts becoming important. But when it is advanced, when the patient has really reached the stage of cirrhosis, then the emphasis shifts to prevention of complications and prevention of progression of the liver disease. Now, there are certain red flags. When you have a routine health checkup, if any of these are present, then that indicates advanced fibrosis or cirrhosis, platelets less than 2 lakhs, GGT more than 45, ultrasound showing coarse ecotexture, dilated portal vein or splenomegaly. If the liver is firm on palpation, SGOT is more than SGPT. And whenever you are in doubt, we must ask for a liver elastography like a fibroscan, which is extremely useful in assessing both the quantity of fat of liver as well as the liver stiffness, which will tell us how much is the damage. How can we prevent non-alcoholic fatty liver disease or MASLD? Weight maintenance. So keep a BMI of in the normal range. 150 minutes of cardiac exercises per week. Control of all the metabolic risk factors like diabetes, triglycerides, hypertension, etc. In diet, avoid saturated fats, simple carbohydrates like sugars. Have normal calorie diet. Avoid late night snacking, midnight meals. Avoid unnecessary medications. The most important culprit is the ultra processed food, anything that is packaged, so where you just open the packet and eat something. Those are the things which are at highest risk of causing MASLD. Once you already have fatty liver disease, but you still have treatment available now. So in diet, a calorie deficit diet, around 500 calories less per day as compared to standard, and avoiding saturated fats, simple carbs, and sugars. Exercise 250 minutes per week. To prevent, you require 150. For treatment, at least 250 minutes per week, and it should be a combination of cardio and muscles. 6 to 8 hours of good quality sleep is equally important. And fortunately, now we have many drugs available for the treatment of NAFLD. The drugs, simple drugs like drugs for diabetes, which are effective, but also which include semaglutide, tirzepatide, dapagliflozin, your other SGLT inhibitors, pioglitazone, but also you have liver-directed drugs like saroglitazar, resmetirom, and very soon you're going to have drugs which are effective like efruxifermin and so on and so forth. If you summarize, weight loss of around 7 to 10% of baseline causes NASH resolution in a significant proportion of patients. And if you lose 20% of the body weight, then you can actually reverse fibrosis in a proportion of patients. Several drugs can cause liver injury. If you look at some of these drugs like acetaminophen or nitrofurantoin or isoniazid or ketoconazole, heparin, very commonly used, statins, but these can all cause liver diseases. Is there any safe limit of alcohol? The answer is no. Any amount of alcohol consumption can actually cause liver disease, and therefore the consumption of alcohol should be absolutely zero. People often feel that if they have food along with alcohol, then they do not get liver disease. But this is not true. While those who do not take food and have only alcohol, they get very severe alcoholic liver disease and they also get malnutrition. But those who take food along with the alcohol, they cannot escape the effects of alcohol. The effects of alcohol would still be there. Similarly, weekend binging versus regular consumption doesn't protect you from alcohol-related liver disease. 30% of people who consume alcohol are going to get alcohol-related liver disease. Another myth is that wine is good for health or beer is not alcohol and it is safe. Both these are not true. Wine is not good for health. Beer is also not safe. Both of these can affect the liver in the long run. Are there any food substances which can help the liver? So there are anti-aging liver protective food like red bell pepper, broccoli, spinach, nuts, avocado, watercress, what we call as jalkumbi or olive, coffee, which is black coffee, the way it is not had in India, like with milk and sugar is not the coffee which is going to help you, but it is the black coffee which is going to be helpful. And then certain fruits like papaya, blueberries, banana, citrus fruits, kiwis, apples, and pear. These can help keep your liver healthy in the long run. Most of the liver diseases can be really treated. In the early stages, even cirrhosis can be reversed, but those people who have very advanced liver disease, they would require a liver transplant. And please remember that life would be completely normal after liver transplant for most of the patients. To summarize, my dear friends, for hepatitis B prevention, get vaccinated. Hepatitis C is curable with simple tablets, but with safe practices like needles, blood transfusions, and safe sex, you can prevent hepatitis C. Do regular exercises, 150 minutes to keep your liver healthy. Eat a healthy, balanced diet, normal calories to avoid fatty liver disease. Have zero alcohol. Don't take any unnecessary medications. And liver transplant is required only for those who have end-stage liver disease. For all other people, there are effective therapies available in presence of even early stages of cirrhosis. Thank you very much.
Thank you so much, sir. Your practical strategies around the liver diseases remind us